What's up everybody, Dr. Rossi, shrinksandSneakers.com. So in this video, I'm going to cover a really interesting case that was in the British Medical Journal involving a teenager who was eating or consuming her own hair. And you might be thinking to yourself right now, Dr. Rossi, what does this have to do with psychiatry? It sounds like some kind of surgical problem. Well, we're going to get into that and discuss it during this video. So first, let's frame the case and explain to you guys a little bit about what this case is and what they found during the workup and examination. So this was published in the British Medical Journal. It's primarily framed as a surgical case, but there is a psych flair to it, and there is an underlying psychiatric diagnosis that we should definitely talk about. So the case goes something like this. The person who is presenting with these problems initially presented because they fainted and or had a syncopal episode. So this person passes out, they hit their head, they come to the hospital, and they're thinking initially, maybe this person has some kind of head injury, we don't know. During the physical examination, they find that this person has a lump in their abdomen. Nothing to do with this syncopal episode seemingly, right? You're wondering maybe why this would be happening, but it turns out that when they looked further into it, they were like, okay, we have this lump. We now need to do a CT scan of the abdomen. Do CT scan of the abdomen. They find that there's this mass in the stomach, and there's also a tear in the stomach or some type of perforation, right? So once they discover this, they realize they need to do surgery, and when they do surgery, lo and behold, they find what turns out to be a 19-inch trichobezor. So a trichobezor, and it was removed, and at that point you might be wondering, what is a trichobezor? How does one get this? So that's exactly what this video is going to be about, and we're going to talk about the underlying psychiatric diagnosis that could lead to someone having a 19-inch mass of human hair in their stomach. Alright guys, so let's get to my favorite part of this case, and that is specifically the psychiatric disorder that the person had. So we come to find out that in this case write-up, this patient had what was a disorder called trichotillomania with trichophagia. Okay, so what does that mean? Trichotillomania is an excessive hair pulling disorder. It's basically someone who cannot stop themselves from pulling out their own hair. So that's the trichotillomania part of it. The trichophagia part of it is the consumption of the hair after pulling it out. So not only is this person pulling hair out of their head, eyebrows, eyelids, etc., they're also consuming the hair after they pull it out. So this is a psychiatric disorder, and what it really involves is this urge, usually related to anxiety, to pull one's hair out, right? It's this overwhelming urge or sensation to pull one's hair out, and this can occur to the degree that the person loses an excessive amount of hair, right? So you can usually see or observe grossly in these patients patches of baldness on the scalp or patches on the eyebrow that are missing, and it's usually pretty obvious. In the event you're not sure or you really want to confirm that this person has trichotillomania, you could do a dermatological evaluation and a microscopic evaluation of the hair. This is rarely ever done. And you might be asking, Dr. Rossi, why is it rarely done? Because most of the patients are going to admit that they've been pulling their hair out. If you ask them, have you been pulling your hair out? They're going to probably say yes, and I have this overwhelming urge and anxiety to pull it out, and I feel some kind of temporary relief when I do so. And when they say those kind of things, you know what's going on. You don't have to go through all of that excessive workup. So what else should we know about this? This disorder does sometimes run in families, and it is common in those with obsessive compulsive disorder. So looking out for comorbid excessive compulsive disorder could be a good idea. And I already said that a lot of times this is related to anxiety. If you were going to treat a patient for this disorder, first line things would be things like sorry about that, not pharmacotherapy. First line, I would do cognitive behavioral therapy. That's a good starting point. And then medication if necessary, or possibly the combination of cognitive behavioral therapy and medications. Things like clomipramine have been shown to be helpful. Alright, so in this particular case, we do know that the person has or carries a diagnosis of trichotillomania already before discussing anything else, so we know that the diagnosis is in place. However, let's say you're confused, you don't know for sure if someone has trichotillomania or whether or not this is a medical condition. There's some things you should definitely look into. One could be alopecia, another could be check an iron level to see if they have iron deficiency. Definitely check a TSH, right, thyroid stimulating hormone, to see whether or not this person has a thyroid condition that could be leading to the hair problem, as well as some other fungal infections and things that could be possible. Tinea capitis is possible, as well as other types of infections. But again, that would be a little more obvious. You would likely note other things like redness or plaques on the head, let's say, in those cases of infectious causes. Most of the time, biopsies and hair samples and evaluation microscopically is not required. So this is another aspect to look out for. If you're unsure whether or not this is definitely trichotillomania, at least look into some of the basic potential medical causes of hair loss. Okay guys, so to wrap the video up, I want to talk just a little bit about treatment for trichotillomania and what you would be looking for. So what you're really going to do is a form of cognitive behavioral therapy with habit reversal training. So habit reversal training is generally the #1 answer or the best potential treatment option for people with trichotillomania. And what you would do with habit reversal training is the individual is trained to learn to recognize the impulse or urge. So you're trying to bring recognition or understanding to them of the urge or impulse to pull their hair out. And then you would look to teach them to redirect that impulse or urge into something else in a different direction. So in a nutshell, that's kind of the quick and dirty version of habit reversal training, but there's also other cognitive behavioral therapy techniques that would be effective in working with this patient population. So psychotherapy remains the first line, specifically cognitive behavioral therapy with habit reversal training. Other psychotherapy modalities have been used, but are not going to be as effective as these. Medication. You might say, well, couldn't there be some type of medication to treat trichotillomania? Yes and no, right? So I'm going to start with the most important point, and that is there is no FDA-approved medication treatment for trichotillomania. So there's no medication that the FDA says there's enough evidence to support its use for this disorder specifically. However, we were talking before that there's comorbidity often with trichotillomania, things like obsessive compulsive disorder, depression, and anxiety. So if the person has a diagnosis of trichotillomania and major depressive disorder and generalized anxiety disorder or obsessive compulsive disorder, you may consider using medication obviously to treat those disorders, and it may have some impact on the person's trichotillomania as well. So what would those medications be? Generally, they'd be things like selective serotonin reuptake inhibitors. Let's say the person has OCD and trichotillomania. You're going to use SSRIs in higher doses generally and for longer durations than what you would use for anxiety and depression. And you would start there and see how the patient does. If that doesn't work, second-line options include things like clomipramine, which is a tricyclic antidepressant. It remains a second-line option because of the side effect profile. So there are some options for treatment of the of other disorders, but not necessarily trichotillomania itself. So I think that's a good place to wrap the discussion. If you guys have questions, comments, want to hear more about this disorder or other disorders and other popular media depictions of psychiatric disorders, I'd be happy to cover those topics. Drop a comment below, and please like and subscribe to the channel. It helps us to keep pumping out content.